There are so many Americans who have a tough time paying for health care or don't fill a prescription because of the cost. A pharmacist and Senior Vice President at CVS Caremark, Joshua Fredell, says patients might be more powerful than they think. He's here tonight to tell us more. Hey, Josh, how are you?
I'm good. How are you?
I'm good. So how can people cope with the trend of prescription medication costs growing so much?
Yeah, it's a great question. The pricing of drugs starts with, how they're priced by the makers of those drugs. But then where a patient can really take control is looking inside of their prescription drug benefit. A lot of people don't understand or maybe realize that for the vast majority of healthcare conditions, there's a lot of different treatment options. And oftentimes those can be lower cost drugs like generics or biosimilars or preferred brands. So starting by understanding your prescription drug benefit is a really important start to starting to take control of the cost of healthcare for yourself.
And how can we make the most of those benefits?
Yeah, knowing the benefits. So if you start to understand what options you have and you take that information to your pharmacist or your doctor, you can start having conversations about if maybe a certain generic drug may be right for you. And that could be a lower cost option. Outside of the medications, understanding your benefit in terms of where there may be lower cost pharmacies or even more convenient ones closer to you or maybe home delivery. Both of those things can help lead to affordability for a patient, but also just easier experience around their medication taking behavior.
Why is it so important that we take care of our health and avoid shortcuts like not getting prescriptions filled?
Yeah, a shortcut can seem like a simple thing to do today, but they add up. And if we're not taking our medications as prescribed by our doctor and taking them regularly, we run a much higher risk of more complications with our healthcare conditions in the future. In fact, about 25% of hospitalizations are tied to not taking medications correctly or consistently. And so by taking our medications each day, it really helps set us on a path to be healthier in the long run, which also means we'll have lower costs in healthcare in the long run.
It sounds really easy to do this, but for some of us, it's not. How can we tap into some available resources or some communities that can make sure that we're getting the help that we need?
Yeah, I'd say two things. One, in terms of just taking your medications as prescribed, use the tools that your pharmacy, your health insurance company, your pharmacy benefit manager, or other tools that you may be able to access, like digital tools. Simple things, simply to remind you to take your medication every day, or maybe to remind you to refill it on time. Those are two simple ways to just stay with your medication each day. And then for extra help, talk to that local pharmacist you have in your community. They know a lot more than just things about the medicine. They can help you understand other ways to take care of your healthcare condition and connect you to other resources, whether it be online or local community resources for those who might be working through the same health conditions you have, using similar medications. There you can be part of a community to learn what is helping others just stay on track with their health, as well as find ways to save, and those may help you as well.
And where can we go for some more information on all of this?
Yeah, you can visit cvshealth.com for more information, as well as check the websites for your local pharmacy and your health insurance provider.
Well, thank you so much. We really appreciate your time today.
Yeah, thank you.
Coming up next, we are getting you ready for Saturday's Spirits and Spirits at the Coronado. We'll be right back.